Welcome back, beautiful people. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. I'm your host, Zen Sams. Now, up in just a few minutes, we have celebrity injector Sari Katz. She's co-founder of Velour Medical, and we're going to be chatting about botox, fillers, and how they are affected by the COVID-19 vaccine and booster, and all you need to know to keep yourself safe while still looking beautiful. Now, there has been an astronomical surge in the number of people seeking cosmetic treatments like derma fillers and Botox as of lately, in part due to a combination of Zoom face, the stress of lockdown, and the inability to get our usual beauty treatments regularly. And cosmetic doctors across the board have noticed the rise in demand. Now, before we go further, remember that Botox and fillers, derma fillers specifically, are not the same things. Botox is an injectable muscle relaxer, while derma fillers are synthetic materials meant to add volume and structure to your face. The global derma fillers market size is expected to reach approximately $6 billion by the year 2028. And while you all may be tempted to jump at the opportunity to book in your next appointment, experts are urging us to plan a little more carefully around when we receive injectable treatments, specifically referring to our COVID-19 and the vaccinations at hand and the protocols involved. As with any cosmetic treatment, Botox and fillers can have side effects, including swelling and inflammation of the treated area. One preliminary study has suggested that there might be an increased risk of an inflammatory reaction to hyaluronic acid derma fillers following exposure to the COVID-19 spike protein. The general guideline is that patients should wait 2 weeks between Botox treatments and COVID vaccination and 3 weeks for fillers, simply because practitioners just don't have enough knowledge on the potential risks and reactions someone could have from the jab. Here to break it all down is Sari Katz. She's co-founder of Velour Medical, an NYC-based cosmetic concierge service. Sari is a celebrity injector and PA. Her specialty is in dermatology and plastic surgery. She has advanced training with injectables and is a certified trainer for the Allergan Medical Institute. She combines modern-day techniques with the latest products to treat New York celebrities and non-celebs alike. Welcome to the show, Stunner.
Thank you so much, Zen. Thanks for having me today.
You got it. You got it. Talk to me about the COVID-19 protocols regarding fillers. Is it really necessary to wait 2 weeks? What side effects are you seeing? And what is the number one request people have with regard to the COVID-19 and injections?
So that's actually a really good question. Because COVID-19 and the immunizations and boosters are all new to us, we're going based on recommendations. We don't have concrete studies yet. The one study that we had from the Moderna immunization complications or side effects showed that 3 in 30,000 of the Moderna participants experienced swelling of their filler after receiving the Moderna shot. Now, that's a really low number. However, we just don't know how that's going to change over time or extrapolate. So what we've been telling our patients ideally is based on old recommendations having to do with the flu vaccine and also dental procedures, right? These are immunization or immunity boosting procedures. So basically, when our immune system is heightened from this immunization or from dental work, our body's looking for foreign products. So fillers, Botox, they're foreign products. We don't want our body attacking the foreign products. So if we give a substantial amount of time between the immunization and when we receive the procedure, it's a safer bet.
That's great. It's always best to be safe. Now, let's move on to the next question because I only have you for a limited amount of time. What is the number one request that patients are asking for these days? Is it lip enhancement? Is it fillers all around? Is it Botox? Is there a rise in one area versus another? What are you seeing?
Yeah, I mean, the number one procedure requested as far as overall injectables is usually neurotoxin, or Botox is a brand of neurotoxin. But as far as the dermal filler realm, we see lip enhancement being one of the most common procedures requested. And that is because, honestly, with the younger generations and millennials getting into this world, we're seeing people that actually want less for aesthetic reasons as far as wrinkle reduction and more for just enhancements like lip augmentation.
Of course, lip augmentation. Now, let's talk about that. You are the in-house concierge for a very famous hotel, and you go room to room for the socialites of the world and celebrities, and you do lip enhancements, as that's your specialty, but you also do all kinds of other procedures. What hotel have you landed at in addition to everything else you have going on?
Yeah, so the HY36, which is the Crown Plaza in Hudson Yards, actually asked me to come on and be a room service botox injector. So yeah, I can be called at any time to be going over to the hotel if it warrants in my schedule, and I can perform in room treatments like botox,
Okay.
filler, chemical peels.
Let's talk about that treatment because we have about a minute and a half left. So what new products are we looking at this new year? And also if you can give me the best non-invasive procedures after you highlight your like top 3 products.
Yeah, so Botox and fillers continue to be probably the top most requested procedures, but other non-invasive procedures include microneedling with or without your blood, like a blood facial, aqua gold treatments, which are really great and trending right now, and then chemical peels have been, substantial in this industry forever, and then there's a lot of non-invasive procedures that can be done in the office as well, like lasers, radio frequency devices, ultrasound devices,
Yes,
a lot of different options.
Those are definitely on the rise. Okay, if you we have about 45 seconds left, and I want to make sure that people can find you. So the best way to find Sari Katz is if you search Velour Medical. You could go on the gram. They're at Velour Medical, or Sari is at Skin by Sari. You could check them out at velourmd.com. Sari, thank you much for joining. It was such a pleasure talking to you.
Absolutely. Anytime, Zen. It's always a pleasure.
All right. Oh, really quickly, double chin. What's the number 1 procedure you're looking at right now?
Kybella. It's an injectable that dissolves fat.
What about definition in the cheek area?
Fillers like Voluma, Radius, things that enhance cheekbone definition.
There you go. You said it. That's Sari Katz at Velour Medical. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York. We'll be right back after this.